bleaching, teeth whitening, yes.
Dr. Fong, lots of people would like to have some cosmetic work done, but basically just whitening their teeth, bleaching the teeth as it's called. Now, there are several ways of doing it, and I would like you to explain to us a little bit, the way where like people go to the pharmacy and buy some trays or some strips. People go to a dentist and get a relatively similar thing, but custom made. And then there's even that thing, I don't know what it is, a laser or something like that, where it's apparently done in half an hour, very instantaneously. And it shades some light on all three of those things, the pros and the cons, if you don't mind.
I'd be happy to. There are 4 different ways in which an individual can whiten their teeth. First of all, as you mentioned earlier, they can go to their local drugstore and purchase an over-the-counter type of whitening system. It essentially has some of the whitening gel on an adhesive, and they basically almost put it right over their teeth. And so then it's allowed to whiten it. Bear in mind, though, that the over-the-counter concentration of bleaching is a much lower concentration than what they would receive from a professional kit that is available in the dental professional's office. So that leads me to the second treatment option, which is the custom trays that are custom made in the dental office based off of your teeth. We first of all take a mold of the teeth, then from there we fabricate a custom tray that is designed for your teeth. The beauty of this system is that it's designed for you. It fits you, it fits your schedule, and it fits the way that you want to proceed with it. So that when you want to whiten your teeth, you have the trays available, it's customized for you, and then you simply place a higher concentration of whitening gel on there to whiten your teeth. So you would get the results a little bit quicker than what you would go through using the over-the-counter method.
Okay.
The third option is the chairside professional whitening system that is done in the dental office. That usually takes about an hour's time of sitting in the chair where we apply a very high strength whitening gel onto the teeth. What it does is it helps to power whiten your teeth. It's almost like a turbocharge and brightening the teeth all within an hour. The only disadvantage that I can see with that option is that it's a one-time whitening solution. It'll help whiten your teeth. You'll be able to maintain it for a while, but just like our own natural teeth would normally do, they will begin to darken over time with cigarette smoking, drinking red wine, coffee, or tea stains. And so therefore, you'll notice that there is a maintenance concern that is integrated into that option. So the fourth option would be a combination of the last two, which is power whitening your teeth in the dental office first. That will help to increase the whitening immediately. And then, to maintain it, have custom trays that are made for you. And then you can whiten those teeth maybe once every few months. Or if you notice that you're going to be going out to a special event or function and you notice your teeth are a little bit yellow or brown, then it's time to place those trays in there, wear it overnight, and that will help to revitalize the brightness of your teeth. And so now then you're ready to go to that party or special event.
Got it. So what I hear from you here is that if because most of us have a certain lifestyle, and whatever that is, good or bad, like getting the teeth yellow because of wine, coffee, it's unlikely that after we bleach it that we change our lifestyle. Most of us don't change it when we try to lose weight. We try to do it with a $10 bill a month and all that stuff. So what you're saying is, if a person gets yellow teeth again, be it a half a year, 2 years later, depending on his heavy use of those things which will stain the teeth, he can continue to bleach them. It's not like with a bypass where you can only have maybe one or two, and then it gets critical, you cannot do it anymore. So this you can continue to, as they get yellow. Is that true, or did I
yes, that's true.
Right?
You are correct. If you notice that your teeth are beginning to yellow, you can re-whiten them. And for every individual, it depends. If they're heavy coffee drinkers, and smokers, then they may need to whiten their teeth several times over the course of 1 to 3 months. But then if you're a very light coffee drinker, you don't smoke, and you have the occasional stains, after your teeth have been cleaned, then you may want to go ahead and whiten your teeth one evening every 6 or 7 months, or as you notice that they begin to discolor. So when you're ready to brighten them up, you have that opportunity to do that.
Right. Now let me ask you, I've heard that sometimes, when a person walks into a pharmacy and buys a whitening kit, and, as you said, it's a little weaker for many reasons, so he might have to wear that tray much, much longer, and etc. But there seems to be something else, and that is, if you forgot that you had maybe a filling or maybe even a veneer in one place or something like that, that those parts, which are not natural teeth, will then not whiten. So if you go and whiten them, then the parts which were a filling, a ceramic filling, or whatever it was is in it, all of a sudden that sticks out. So you might actually look a little checkered when you come out with that whitening. Is that true?
Yes, that's true. The natural teeth will brighten, but the restorations will not. They remain the same color that they are at. And I think that's where it's very important that the individual does see a dentist on a regular basis, so that way the information and guidance can be there. A person who goes to the pharmacy and picks up one of those over-the-counter and they don't see a dentist, then there may be side effects to it. And so seeing a dentist, we can help.
Side effects, right?
That's right. It truly is. It's a visual side effect. And it's noticeable. I mean, we all want to have brighter teeth, but if we're not proceeding with the correct guidance, then that side effect shows up, and then someone's going to definitely notice the difference.
Right. Well, at least before they were like, nicely yellow, but evenly yellow, because anything uneven sticks out so much more than the even one, right?
That's right.
So at least before a person goes to and picks up some major whitening kit at the pharmacy, you should maybe, go to a dentist and say, look, do I have anything in it which might potentially not get white, and then I might look like a zebra or something like that?
Yes, definitely consult the dental professional.
Wonderful. Thank you very much, Dr. Fong.